Coronary artery disease, stroke, and respiratory infections represent most deaths throughout the world annually. Nonetheless, when individuals consider the deadliest sicknesses on the planet, they most likely concentrate on the serious ones that are distributed in headlines regularly. Be that as it may, large numbers of these infections are not included in the main 10 reasons for deaths around the world every year. The astonishing reality is that many of the deadliest sicknesses are somewhat preventable. Preventable factors include an individual's residence, admittance to preventive treatment, and the nature of medical services available. Here are the 10 deadliest sicknesses on the planet. Number 1. Alzheimer's sickness and different dementias. Alzheimer's sickness is a dynamic infection that obliterates memory, slows down navigation, and hinders typical mental capabilities. These incorporate reasoning, thinking, and other regular ways of behaving. Alzheimer's infection is the most well-known sort of dementia on the records for around 60 to 70% of cases. The sickness gets going by causing gentle memory issues, trouble reviewing data, and slips in memory. Over the long run, be that as it may, the infection advances, and you might not have memory of huge time frames. Risk factors for Alzheimer's sickness include being over 65 years, a family background of the sickness, hereditary qualities, existing gentle mental weakness, Down syndrome, undesirable way of life, past head injury, and depression or social confinement. There's not as of now a method for forestalling Alzheimer's infection, and scientists doesn't know why certain individuals develop the disease and others don't. As they work to comprehend this, they're likewise attempting to track down preventive strategies. One thing that might be useful in reducing your risk of the illness is following a sound eating regimen. As a matter of fact, eating a lot of natural products, entire grains, and vegetables could uphold intellectual capability and delay mental decline. Number 2. Cirrhosis. Cirrhosis is the after effect of ongoing or long-term scarring and harm to the liver. The harm might be the consequence of a kidney sickness, or it very well may be brought about by conditions like hepatitis, alcoholic liver illness, or non-alcoholic liver infection. A sound liver removes harmful substances from your blood and sends clean blood into your body. As substances harm the liver, scar tissues develop. As more scar tissues form, the liver needs to work harder to work appropriately and may ultimately quit working. Risk factors for cirrhosis include ongoing liquor use, fat gathering around the liver, non-alcoholic liver sickness, and ongoing viral hepatitis. Reducing liquor consumption can assist with preventing liver harm and cirrhosis. In like manner, you can forestall non-alcoholic liver illness by partaking in a nutritious eating regimen high in products of the soil and low in sugar and fat. You can bring down the probability of contracting viral hepatitis by utilizing protective techniques each time you participate in sexual intercourse, and by abstaining from sharing whatever might have trace of blood, like needles, razors, or toothbrushes. Number 3. Constant obstructive pneumonic disease, COPD. Constant obstructive pneumonic infection, COPD, is a long-lasting, moderate lung sickness that makes breathing difficult. Constant bronchitis and emphysema are types of COPD. Risk factors for COPD include smoking or handed-down cigarette smoke, lung aggravations like synthetic vapor, family ancestry, and history of respiratory contaminations as a kid. There's no remedy for COPD, yet its movement can be reduced with prescription. The most effective ways to prevent COPD are to quit smoking and stay away from handed-down cigarette smoke and other lung aggravations. On the off chance that you experience any COPD side effects, seeking treatment quickly is very important. Number 4. Dehydration because of diarrheal infections. The danger is the point at which you pass at least 3 diarrheas in a day. On the off chance that your looseness of the bowels endures in excess of a couple of days, your body loses a lot of water and salt. This causes drying out, which can be deadly in serious cases. Looseness of the bowels is normally brought about by a digestive infection or microorganisms sent through contaminated water or food. It's especially far-reaching in regions with poor sterile conditions. Diarrheal illness is the subsequent driving cause of death in kids younger than 5 years of age. Around 500,000 youngsters pass on from diarrheal sicknesses every year. Risk factors for diarrheal sicknesses include living in a community with poor sterile conditions, not having clean water, age, malnourishment, and a weak immune system. The best strategy for anticipation is rehearsing great cleanliness. Hand washing, further developed disinfection and water quality, and admittance to very early clinical treatment can likewise assist with preventing diarrheal sicknesses. Number 5. Diabetes mellitus. Diabetes is a group of infections that influence the creation or utilization of insulin. In type 1 diabetes, the pancreas can't create insulin. This sort of diabetes is believed to be brought about by an immune system response. In type 2 diabetes, the pancreas doesn't create sufficient insulin, or insulin can't be utilized readily. Type 2 diabetes can be brought about by various elements, including poor eating routine and actual dormancy. Uncontrolled diabetes can harm the nerves and veins. This can prompt kidney failure and visual impairment. Individuals in low-income nations are likely to die from complications from diabetes due to restricted admittance to medicine and technology to oversee glucose levels. Risk factors for diabetes include overweight or obesity, hypertension, old age, lack of exercise, and an unhealthy eating routine. While diabetes isn't generally preventable, you have some control over the seriousness of side effects by practicing routinely and following a balanced, nutritious eating regimen. Adding more fiber to your eating regimen can likewise assist with controlling glucose levels. Number 6. Ischemic coronary illness, or coronary artery disease, CAD. This destructive illness happens when the veins that supply blood to the heart become narrow. If left untreated, it can cause arrhythmias and cardiovascular breakdown. Effect of coronary artery infection is as yet the main source of death around the world. However, death rates have declined in numerous nations in Europe and the US on account of better general well-being, education, and adequate medical care. In any case, in many developing countries, death rates for the illness are on the increase. Risk factors of ischemic coronary illness include hypertension, elevated cholesterol, smoking, family background of the infection, diabetes, overweight, and obesity. Ways to decrease your risk of ischemic heart disease include exercising regularly, achieving and maintaining a moderate weight, eating a diet that is low in sodium and high in products of the soil, abstaining from smoking, and avoiding alcohol. Number 7. Lower respiratory infections. A lower respiratory contamination is a disease in your respiratory tract and lungs. It tends to be because of flu or seasonal influenza, pneumonia, bronchitis, or tuberculosis, TB. However, infections normally cause lower respiratory diseases. They can likewise be brought about by microorganisms. Coughing is the main side effect of a lower respiratory contamination. It might deliver bloody sputum. You may likewise have a fever, or chills, or experience shortness of breath, wheezing, and a tightness in your chest. Risk factors for lower respiratory disease include the flu, unhealthy air quality, or regular exposure to lung aggravations, smoking, asthma, and a lowered immune system. Perhaps one of the best preventive measures you can take against lower respiratory diseases is to have regular medical checkup. Individuals at high risk of pneumonia ought to likewise get an immunization. Make certain to clean up routinely with cleanser and water, to stay away from microorganisms, particularly prior to touching your face or eating. In the event that you have a respiratory contamination, remain at home and rest until you feel quite a bit improved, as rest works well on recuperating from illnesses. Number 8. Stroke. A stroke happens when an artery in your brain is blocked or ruptures. This can make some brain cells die in no time. After a stroke, you feel unexpected numbness and disorientation, or experience difficulty walking and impaired vision. If left untreated, a stroke can cause long-term inability. Strokes are the main source of long-term inabilities, as a matter of fact. Individuals who get treatment in no less than 3 hours of having a stroke are less inclined to have complications. Risk factors for stroke include hypertension, family background of stroke, smoking, being African American, and being female. Some risk factors of strokes can be reduced with preventive consideration, prescriptions, and changes in your lifestyle. As a rule, a healthy way of life can bring down your risks. Stroke avoidance strategies might incorporate controlling hypertension with drugs. You ought to likewise keep a sound way of life, complete with ordinary activity, and a decent eating regimen that is low in sodium. On the off chance that you smoke, consider stopping and drink just with some restraint, as these activities increase your risk of a stroke. Number 9. Tuberculosis, TB. Tuberculosis TB is a lung condition brought about by microbes called Mycobacterium tuberculosis. It's a treatable airborne bacterium, albeit a few strains are impervious to traditional medicines. TB is one of the top reasons for death in individuals who have HIV. Besides, individuals who have HIV are multiple times bound to foster dynamic TB. The instances of TB have fallen 2% every year. Risk factors for TB include diabetes, HIV contamination, a lower body weight, and standard utilization of specific prescriptions like corticosteroids. The best protection against TB is to get the Bacillus calmette-guerin antibody, which is generally given to babies and youngsters in regions where TB is normal. On the off chance that you think you've been exposed to TB microscopic organisms, a specialist can recommend preventive medication to bring down the probability of fostering a functioning contamination. Number 10. Trachea, bronchus, and lung cancers. Respiratory diseases include malignant growths of the windpipe, larynx, bronchus, and lungs. The primary causes are smoking, recycled smoke, and natural poisons. Be that as it may, household pollutions, such as fuels and mold, also contribute to the illness. Tragically, numerous nations in Asia keep on using coal for cooking. Fuel emission represent enormous amount of cellular breakdown in the lungs of both males and females. Trachea, bronchus, and lung cancers can affect anyone. But they're probably going to target the people who have a background marked by smoking or tobacco use. Other risk factors for these diseases include family history and exposure to natural factors, for example, diesel exhaust. Besides staying away from exhaust and tobacco items, it isn't known whether there's anything more that should be possible to decrease cellular breakdowns in the lungs.